Human milk is like ice cream, penicillin, and the drug ecstasy all wrapped up into pretty packages. As a mother, this is something I'm very passionate about. I breastfed my son for the first year of his life, and I plan on breastfeeding my daughter when she is born in a few weeks. It is not just another source of nutrition for the infant. Today I will be speaking about how breast milk is produced, what breast milk is made up of, and some of the many benefits that breast milk has for mom and baby. First, let's talk about how breast milk is produced. During the second trimester, colostrum starts to be produced in the breast tissue. Colostrum is full of fats and calories that is crucial to the first few days of the infant's life. According to AmericanPregnancy.org, a teaspoon is all the infant needs to feel full. A sudden drop in hormones after the baby is born and the placenta is delivered signals the breast tissue to start producing milk. 2 to 3 days after the milk is started to be produced, supply and demand kicks in. This means that the more the baby nurses, the more milk is produced. Now that we've talked about how breast milk is produced, let's talk about what it is made of. Breast milk is perfectly formulated with proteins, fats, and carbohydrates and cannot be duplicated. Antibodies are present in breast milk that help prevent illnesses in the baby before it can have vaccinations. According to nursingschools.net, fat-soluble vitamins A, D, K, and E are very important to an infant's nutrition. These vitamins are only present in the breast milk if the mother has them in her diet. So doctors would recommend that the nursing mother keep taking her prenatal vitamins while she is breastfeeding so that the baby can get these vitamins. So now that we have discussed how breast milk is produced and what it is made up of, let's discuss the benefits that breast milk has for mom and baby. Breast milk raises the IQ in babies that nurse or breastfeed. It helps with brain development and helps develop mental skills. It lowers the risk of asthma, and childhood obesity. It lowers the risk for lower respiratory infections. It lowers the risk for SIDS, which is sudden infant death syndrome, and it has been known to cure pink eye, even though they have not done scientific studies about this. Many breastfeeding mothers will swear by it. According to Women's Health, the act of breastfeeding lowers the risk of breast cancer and ovarian cancer in a breastfeeding mother. In conclusion, you have now learned and heard many facts about breastfeeding and breast milk. It is not just another source of nutrition for the infant. I've told you how breast milk is made, what breast milk is made up of, and some of the many benefits that breast milk has for mom and baby. I'm sure at the beginning of my speech, you could or might have had some doubts about breast milk, and I hope that I changed your mind. Thank you.